One of the main questions we get is what is the difference between PRK and LASEK? Okay, our competitors used to say they did PRK. Dr. Dovzhik, who works for me, noticed that on their websites they're now saying they do LASEK. They didn't change their procedure, they just changed the name to compete with us. So, what is PRK? PRK is the first procedure, it takes a long time to heal. You're basically using a little electric toothbrush called an amoylus brush. It's got these nylon bristles and it goes zzz, and it basically sandpapers off the epithelium cells. It looks like it's clean at the end, but you have to understand you're killing millions of epithelial cells right on the cornea. And when they die, they degranulate and release histamines and other chemical modifiers and mediators that cause an inflammatory reaction, which results in pain for you and also sometimes scarring. A LASEK is also synonymous with alcohol-assisted PRK. I was actually one of the three doctors at Harvard that helped invent this about 25 years ago. The other doctors were Jonathan Talamo, my preceptor, and Juan Carlos Abad, one of his fellows. So by using alcohol, you just kind of delaminate, it kind of lifts up the epithelium, and then you could take it off, so it's better than the amoylus brush. The problem is the alcohol kind of leaks, and then you have some of the cells that are dead from the alcohol that you're not taking off, and it's impossible to get a really clean demarcation. So basically, that's why we switched from alcohol-assisted PRK or LASEK to epi-LASEK. Epi-LASEK uses a blunt plastic separator to skid across the cornea. It's dull, so it's not supposed to go into the cornea. It just skids across and again delaminates or removes the epithelium. About 20 years ago, we were putting the epithelium back, but I stopped doing that, and then I published these results, and now most surgeons in the country don't put the epithelium back because it actually makes the healing longer. So you might say, okay, if you don't put the epithelium back, why is it better than a PRK? It's really just because on a microscopic level, if you look at the separation, it's much cleaner, and then you don't have the alcohol. The latest way to do this is pneumolasek. No one else does this in the world because I invented this about 2 or 3 years ago. The reason is we ran out of the separators because the epi-LASEK separators, that company went bankrupt and we had to 3D print them. And then one day the 3D printing didn't come in and we had surgery, and I said, hey, why don't I try just sucking up the cornea into the suction machine with the air pressure and try to use that without the separators, and it worked great. Okay, so basically pneumolasek even gets rid of the danger of the separator going to the cornea. That would happen about 1 in 1,000 times. You might say 1 in 1,000 times isn't a lot, but if it's your eye, it's 1 in 1. So the safest way that you can get laser vision correction is pneumolasek. It's safer than PRK. You don't have scarring. It's safer than epi-LASEK. You don't have the chance of the separator going into the cornea. It's much safer than LASIK. It's like 10 times safer. LASIK, you could have problems such as epithelial ingrowth, flap wrinkles, distorted flap, partial flap, full thickness flap, debris under the flap, a DLK or diffuse lamellar keratitis, which is inflammation under the flap. There's many flap-related complications that you can't get with LASIK or epi-LASIK or PRK or pneumolasek because you're not cutting a flap. Anyway, we did a study where we did PRK in one eye and LASIK and epi-LASIK and pneumolasek in the other eye. It's a much quicker recovery. And the reason you know that is our competitors that are doing PRK, Greg Pamel's doing that. He's a great cornea surgeon, doesn't do that much refractive surgery. And when he has to go to the surface because the cornea is thin, you can't do a LASIK, he'll do a PRK. And he actually says to his patients, I'll do one eye and then wait a couple weeks and do the other eye because it's so painful, you can't do both eyes at the same time. We had a guy working for us, Matt Reel, who went to medical school. And before he went to medical school, he had PRK, and he said he was in agony. He was on narcotics in a fetal position for 5 days. Matt's like a big jock athlete kind of guy, so that really does say a lot. And then after he was working here for a few years, he did an enhancement. He did a epi-LASEK, and he said, whoa, totally painless. It was totally different, okay? So if you want the safest procedure, you have to do non-cutting. If you don't like pain and you don't like a long recovery, you can't do PRK. Anybody out there who is told they should do PRK should not do PRK. It really means the doctor said you shouldn't do a cutting procedure. We don't have enough tissue. You have to do non-cutting, and the non-cutting I do is PRK, but PRK is outdated. I did my last PRK in 1999. Is how outdated it is. Okay, so anyone out there was told they should do PRK, it really just means they have a thin cornea, can't do LASIK, and then they should do epi-LASIK or pneumolasek. Anyway, just come in, we'll explain this all to you. And it's a little bit complicated, so I guess the take-home message is PRK is outdated, hurts a lot, and sometimes scars. LASIK is a more modern way. Alcohol-assisted PRK is the same as LASIK, and then epi-LASIK is more advanced, and pneumo-LASIK is even more advanced because I invented it. Okay, thanks a lot. Any questions, just contact us. The consultation's free.